Mrs. Neena Gulati, she's I guess 52 now. She came to us in 2019, just before the COVID wave hit. So I was probably one of the first therapists who got an opportunity to evaluate her. She was brought in on a wheelchair with significant behavioral deficits. She was very aggressive. She had, abusive behavior because of the brain trauma. It was not her natural behavior, and she was completely disoriented. She was not clear where is she, what is she doing. Uh, it's interesting to know that by her background, she is, as what she tells us, she is a psychologist, and she have had a very fantastic, a college life, fantastic married life with her husband. She has two kids. They are all living in Chicago. Her husband is, quite a successful businessman. When they got here, we were surprised first because she is coming from the Western world where technology and the rehab facilities, as it is known, is at the peak. That means they are way ahead of what at present our neuro rehab services are. When they landed here and we saw her, as of what I explained, how her presentation was, we were also thinking, what can we deliver for her? And they were not worried about the time at that point, because he wanted, Mr. Gulati, he wanted Neena to get better and go back to how she was before.
Yeah, about Neena Gulati, she's a about 55 years old lady, and she got married and she got settled in US, and she has a daughter and a son. Both are teenage people, and a good family. And on one fine day, she got a stroke, and then they this is stroke a type of like multiple strokes she got, post cardiogenic, and then it's a multiple stroke. So they have tried their best in US. The husband told that we have tried in US, but what they have told us is not rehabable. We cannot rehabilitate her.
Apparently, she is one of those ladies who had designed her own, houses, entire basement, and made it into a marvelous place where every now and then they would have huge parties. She would organize everything herself. From there, she had become a completely dependent person, who could not even figure out what she wants to eat and when she wants to eat. Does she want to use the washroom? So she was in that state. We started her journey at that time. Her C2 CBIR, the Comato Community Brain Injury Rehab score, was somewhere around 2A. And because of the behavior issues, we were struggling a lot, because anyone who would try to, handle her left hand and left leg, for sure he is going to be kicked. She would sometimes even bite, sometimes she would spit, sometimes she would give the choices of abuses. And as professionals, we know, it's a brain which is misbehaving. It's not her original personality. So we start.
So the first time when I saw her, it was 3 years back in Jain Hospital, Bhagwan Mahavir Jain Hospital. She got admitted in Jain Hospital. We started treating her. She was literally like a baby. She cries. She doesn't know how to communicate. If you give a brush, she doesn't know what to do with the brush. So she cries and these. And also she was very kind of behavioral issues, like she showed tantrums like a child and things and all. And she was confined to bed. She was unable to turn, unable to get up, and unable to sit. So these things are the initial presentation. And she stayed there for about an year, stayed in inpatient facility.
Started with therapies which involved normalizing her abnormal muscle tone, trying to help her learn to adjust to that environment, allowing her to understand what is happening around her, working on her cognitive status, working on the lower limb control, so that she can learn how to sit herself, how to walk at least to the washroom from the bed, so that she can take care of her immediate needs to pass urine and clean herself, to communicate with sense, to understand what other people are telling. So you understand, like, it's not just one therapist working there. It's not one person who takes the credit in this. This is an entire team who works together.
During this time, we had to train her all her functional ability, including the toileting. Like, how do you train a baby? Like, if you have to pass, urine, you have to say, "Sss," and you have to show the toilet. So, in the cognitively, you have to stimulate for her to pass at the right time. We have to show her pictures. Everything has to be stimulated. Everything has to be trained for her. Like even food, plate, spoon. So everything has to be taught to her. Next stage is like then she came to a level that where she started understanding 1 or 2 step commands and started following that time, and she also started she had a severe spasticity in this hand. What happened in brain injury is like initially in like movies it won't go like this actually. So initially it will be a flaccid only in stroke patient, and gradually it is a it's a sign of negligence, you can say. Actually, people if you're coming, so none of our patients who are in Jain Hospital from the beginning, from the acute phase, they are not none of them are having this kind of posture and this kind of spasticity, unless until it's a severe head injury which can go. This is called rigidity. Because of the rigid posture they will develop this. Otherwise, normal stroke patient, they don't go like this.
There have been days when she would just refuse to do therapy, and we have done something known as distraction therapy. So the idea is to involve her in certain aspects of her rehab without directly involving her into rehab. So as an occupational therapist, I understand that better because we venture into the patient's hobbies and interests much more deeper, because that's where we start rehabilitating them. We venture into their self-care needs. So we try to distract them and involve them in some of those activities which they find purposeful. Similarly, the physical therapist started working on her balancing gait, as I told you. Speech language pathologists, they were constantly working on her cognitive abilities as well as speech and cognition. In a span of 1 year, she came to a point where she started telling that she wants to use a washroom from being a complete dependent on diaper or a catheter. She started interacting with the therapist. She started recognizing them. Me being one of the oldest therapists who has seen her right from the beginning here, she recognized me much better than any other person, because other people, they were frequently changing, but over the time I saw she was able to adjust with different people, which itself is a mark of recovery.
So she came with that actually. Then we had to work on that, and we had to splint her hand to make sure that the length of the muscles are not gone down. And then we worked on her hand function. She's almost started using her hand, and she started picking up the things in this manner. And also she started holding things and started walking parallel bar. That means she has to roll, get up, sit, and then she has to hold the thing and stand and walk in the parallel bar. That much she came. By the time she came to that level, and then they got discharged and then went back to US again, and once again they came back 1 year back with a little bit of deterioration, because the continuity of therapy was not there because of that. This time she got admitted in the hospital, and then she moved to our inpatient means resort facility, which is in Devanalli, near to the airport. It's called FGR, Fantasy Golf Resort. There she stay there and takes therapy. So this time the improvement is transformational actually. Now if you talk to her, like she took 4 to 5 hours of therapy. Now if you talk to her, she functionally communicate with you. So now she having a functional deficit called naming difficulty. So this means someone is not talking at all, crying like a baby. Now she slowly started understanding, and then she started communicating. Now she is having only naming difficulty. That means she is unable to retrieve the name from her memory. So that also slowly resolving. Now she's functionally communicating, but slowly. That is her state now.